So thank you everyone for coming. It's really nice to have people that have been in the department before. I can see some of the names of even my former students, which is quite fun, and also a few of the current students. Although of course, as those of you that did the degrees in the past will remember, this is exam season, so fewer than we would like are coming because they are all worried about preparing their exams, which this year will be online. So that's very different to when you actually did your degrees in the past. So it's fantastic to receive you all. For the department, it's important to have conversations and to have an interaction with alumni for a lot of reasons. Partly that we feel that you are part of our community, our family. Partly that we would love to have connections between all of you and our students and find new ways and more creative ways to support each other. Partly that it would be fantastic to have you once in a while coming back to Oxford when that's possible, to very much know how you are doing, partly because you might have ideas on fundraising, but partly, and this is the main reason today, because it just happens that many of us continue working on issues that we deeply care about, regarding refugees, regarding migration, regarding development more generally. And therefore, it seems to be an opportunity to use to have conversations between people that are working in the department on some of these issues and others that continue successful careers in other parts. And that's very much what we intend to do with this show and tell, to learn exciting work that has taken place in our centers, but also from individual academics, but also learning more about how some alumni that did a PhD or different MAs with us are dealing with a problem that is affecting so many people, or many times struggling with that problem as well. So I wanted to welcome you all, although welcoming to a screen for me, it's always disappointing, and I hope we can welcome you in person in Oxford in the future. And thanking Joe for the whole organization and Matt for chairing this session. We will have one session now of 1 hour and 30 minutes. And then in the afternoon after lunch in the UK, we'll have another session that I will chair. So Matt, all to you. And again, thank you so much. And I hope it's very enjoyable for everybody.
Thanks, Diego. And let me just join with Diego. By the way, I should say I'm Matthew Gibney, the Director of the Refugee Studies Centre, if you don't know me. I know a lot of you, but you probably don't. Probably everyone here hasn't met me. But I'd just like to say as well how fantastic it is to see such a great turnout of alumni and others connected to ODID who can share their experiences. And one of the really great things of this is that the speakers, even just in this first session, are coming from different parts of the world. And I think that is obviously fitting in the case of a global pandemic as we're dealing with here. Just to remind the speakers, they'll each have 10 minutes, and then we're going to have a break after the first 3 for questions and answers before we go to the final 2 papers. I say the final 2 because the last speaker on this panel has had to drop out because of a work-related emergency. That's Gemma Robson. So we have 2 speakers just after the short break in this first session. If people want to ask questions, they can either put them in the chat box as we go along, and I can read them out, or you can put up your hand. But without any further ado, we'll get on with it, and we'll go very much in the order that we have on the schedule here. We're going to start with Corey Rogers, the Pedro Arupe Research Fellow in Forced Migration Studies, attached to the Refugee Studies Centre. And the title of his talk is Reaching Mobile Peoples During the COVID-19 Response. So take it away, Corey.
Thanks, Matt. Let me just pull up my slides. You can see that?
Yep.
Great. Well, thanks, Matt, and thanks also Diego and Joe for organizing this. I'm going to keep my presentation relatively short because this is a project that's still very much in its early stages. And in fact, the data collection just started last month. So really this is useful. This is going to be useful, I think, to get some feedback on the concept we have for this project and maybe get some ideas on how to tweak the implementation as we take it forward. I'm not going to be sharing any outcomes so much as explaining what we're studying, how we're doing it, and why. So the project that I'm describing here is a cross-regional comparison of the ways that mobile peoples, and I'll come back to the definition of that term, how mobile peoples have been affected by or excluded from health responses to the COVID-19 pandemic. This is actually one component of a broader pump priming project with John Fell funding that is titled Reimagining Development for Mobile Peoples. Here at ODID, it involves myself, Professor Don Chatty, and Matthew Porges, and we also have a number of co-investigators elsewhere, some of whom are listed here, and we've also, this is sort of an expanding network of academics who are contributing to the cross-regional dimension of this project. So I think it's useful if I start with a brief overview of the overall aims of the project before I sort of delve into the specific COVID-19 aspect. And the first thing we should start with is this term mobile peoples. When I use this term, I'm not simply referring to people who are mobile or people who move, who are often labeled with the term migrant. Rather, I'm referring to a subset of traditional and indigenous peoples for whom mobility is central to cultural, economic, and political organization, as well as group identity. This is a term, and the S at the end of peoples is specific here. This is a term that's coming from the lexicon of indigenous and traditional people's rights. So it's referring to groups that consider themselves in many cases to be a culture or a cultural or social group. This includes pastoralists. It includes nomadic traders, such as those that are involved in caravan trade in the Sahara and elsewhere. It involves peripatetic peoples, which include travelers, Roma, and Gypsy groups who are in Europe and the UK and the wider Mediterranean area. It also includes some itinerant forest communities. One other group that's sometimes overlooked, and actually it's never entirely clear whether they should be included in the mobile peoples category, is Swidden agriculturalists who shift the plots where they cultivate their crops. Now, this is a very, in some ways, it seems like a very sweeping category, and there isn't a lot that in the actual practice of everyday life that would bind these groups together as mobile peoples. But despite this heterogeneity, what mobile people do share is a somewhat antagonistic relationship with the ways that mainstream development is practiced, and which in the literature it's often been shown this is often privileged a sedentary way of life due to certain assumptions of what development should look like. So in this regard, our project is a response to notions of sedentism. And by sedentism, I'm referring to assumptions implicit in mainstream thinking that privilege sedentary social forms. And these often manifest in policies that even claim to be supporting mobile or peripatetic lifeways or mobile indigenous people. I should distinguish that when I talk about sedentism, this needs to be distinguished from two other processes that are also often brought up and specifically in development studies and forced migration studies. And those are development-induced displacement, which is the forcible displacement and dispossession of people due to development projects, as well as forced sedentarization, which is where mobile or nomadic people are forced to settle in an urban area or with permanent residence. Both of these two other processes have been discussed very thoroughly, and they're often, one, they often go together, and two, they're often defined, they often take place through overtly coercive tactics. Sedentism that we're describing here is more subtle. It's part of the epistemic baggage of a long lineage of development policies. And it includes, there are certain aspects of this that we've identified. So development often takes place along the lines of static infrastructure, It's based on an idea of fixed permanent residence. Often development takes place in a way that is based on private land and resource governance, so privatization. And of course, in terms of the provision of social services, there's often an urban focus or a sedentary focus. So the aim of the project then is to take a cross-regional survey of how mobile peoples have been affected by development broadly. And we're looking at various sectors, including education, healthcare, provision of housing, provision of water. And we're focusing on 5 locations where mobile peoples live. And this is based on the long-term research relationships of the individuals on the project. So my own work is in Turkana with pastoralists in northwestern Kenya. But we also have researchers looking at Mongolian herders in Central Asia, at Bedouin in Lebanon and Jordan, at Sahrawi nomadic groups in Western Sahara and Mauritania, and also in Italy, looking at Sinti and Romani traveler communities. Now, specifically looking at COVID-19, our interest was to take COVID-19 as something of a case study, not necessarily of a humanitarian response, but to look at the ways that the response to COVID-19 in various areas reflects the systems that have been developed over decades of development funding in these different areas. And we're trying to look at the ways that they do or do not include pastoralists, nomadic groups, and traveler and Romani communities in their responses. So this is a broadly comparative, broadly exploratory study. What we're doing is generally taking research forward in 2 phases. At the beginning of the research, the first phase is to conduct key informant interviews with various sort of institutional actors who are involved in planning and implementing the response to COVID-19 in these different areas. So this, of course, includes governments, government ministries. It includes the third sector, so NGOs, religious groups, community-based organizations, civil society initiatives, and then also looking more specifically at the healthcare practitioners themselves, so hospital administrators, physicians, community health workers. In some cases, it would be dispensary workers who are sort of on the front lines of the response. And we're going to be doing interviews with them to get a sense of what's actually being done specifically in areas inhabited by mobile peoples and what's being done to reach them and to mitigate some of the specific effects that COVID-19 has on mobile peoples. And I'll note here that it's not always just about, of course, the effect of COVID-19 itself, but also the effect of the responses to COVID-19, which tend to involve an attempt to restrict movement. And that has particular effects on people whose livelihoods and ways of life depend in particular ways on mobility. We're also through this, we're not actually collecting any quantitative data, but rather we're trying to identify what existing data is available in these locations. So looking at access to equipment, PPE, the availability of ICU, intensive care units in some of these areas, and of course, access to oxygen. We're looking at testing rates, caseloads, and where we're looking at the degree to which this does or does not discriminate between certain mobile peoples and the general population. In many of the places where we're working, vaccination has not been widely rolled out yet, but we are looking at the outlook on vaccination and the degree to which mobile peoples are included in that strategy. And of course, a really key point here is just the information dissemination. So the degree to which mobile peoples who often live in separate areas or who are otherwise a bit more disconnected from the urban centers, looking at the ways to which they have the ways in which they do or do not have access to information about COVID-19 and what the health response is. Following this, phase 2 is actually going to be to do a few select interviews with members with mobile people's households. Very few of these, and the idea is not to do an extensive survey or anything. That's of course not really possible yet with the state of the pandemic in some areas, but to do a few select interviews with people to get an idea of the degree to which the things that we found when talking to institutional actors actually reflect the experience of members of mobile people's communities in terms of the ways that they have been included in the response to COVID-19, as well as ways that they've been affected. A few of the target issues we're looking at is we're trying to identify whether there are, MP here is referring to mobile people, so whether there are policies that are specific to the livelihoods of mobile peoples or the places where they live, whether mobile peoples or nomadic groups or whatever label is used in that particular area is recognized by healthcare providers. And this I'll just note can actually go both ways. In some cases, if there's no recognition of mobile peoples, they actually tend to be excluded from the response. There are other cases where physicians, for example, in Turkana in Kenya, where I work, where in some cases mobile peoples are recognized as a sort of distinct category requiring special outreach, but it's also sometimes seen as an excuse for not providing care to that group because they're inherently hard to reach. So the recognition of the label actually isn't inherently good or bad. It depends on how it's used in policy. We're also looking at community outreach and the degree to which those policies have helped to foster or inhibited trust in institutions. We're looking at the specific effects that the virus and so the pandemic and the public health response to the pandemic have had on mobile peoples. We're looking at some of the practices that mobile peoples themselves put into place in response to an epidemic. In many areas, nomadic peoples have long had certain practices they'll use to prevent either, in the case of pastoralist livestock diseases or also human disease epidemics. And one of the tactics is dispersal. And this is something that's often prevented by governments because it's seen as a manner of potentially spreading COVID-19. But in many cases, this would actually be similar to a social distancing tactic among mobile peoples. And then the final point I mentioned, we're trying to find out what data is already available, and we're using that to look at some of the disparities between mobile peoples and the general population. So I'll stop there, and I'll just note again that our funding is coming from the John Fell Fund, and this is of course an early pump primer project. So we're hoping to expand later, but yeah, keen to hear any feedback and ideas from those who've listened. So thank you.
Thanks, Corey. And we're going to get feedback at the end of the first three talks, as I said. Okay, so let's go to Doug. Douglas Scott is coming to us all the way from Abingdon. He's a research officer at Young Lives, so he's actually part of the ODID at the moment. And his talk is on the impact of COVID-19 lockdowns on the experience of domestic violence amongst young people in Peru, evidence from a list randomization experiment. So Doug, it's over to you.
Thank you very much. I'm just going to check that we can see everything we need to see.
It's up.
It's all up. It's all up there. Okay, fantastic. That's good. Great. Okay. Well, good afternoon, everybody. The paper I'm presenting today relates to the very emotive topic of domestic violence, and we're looking at this in the context of the extremely lengthy and severe lockdowns in Peru during much of 2020. So obviously domestic violence was very much at the top of many policy agendas prior to COVID. However, we're now seeing a large body of evidence which points to the responses of governments, in particular lockdowns and stay-at-home requirements, actually placing potential victims more in harm's way, so exacerbating this problem. So what we do in this paper is we quantify the increase of physical domestic violence in a sample of around 18,000 young people between 18 and 26 years old from the Young Lives cohort longitudinal study in Peru. And we do this with a rather unusual approach. So we use an approach called list randomization. I'll speak a little bit more about that in a second. What we find overall is we find that around 8% of our sample give answers in our experiment which is consistent with an increase in physical domestic violence since the beginning of the lockdowns. We also find that there's no significant difference between the two genders, between male and females, in the increase. I'm going to show you in a second that the levels, the underlying prevalence is very different between males and females, but the increase is not. The key finding from this paper, however, is that for those in a previous wave of our survey who reported experiencing domestic violence in their household, around 1 in 4 of this group also experienced an increase during the lockdowns. And this compares to only around 5% of those who weren't in this group. So Peru occupied the unenviable position of having the highest COVID-19 cases and deaths per capita throughout much of 2020. Only this week, they've also just revised their official fatalities government figures. And again, they find themselves back in this position again in 2021. The country has also been referred to as having imposed some of the strictest lockdown conditions in the world. So this began March 16th to the 30th of June with a nationwide lockdown, but then this was continued over July, August, and September in many provinces. The country also has historically high levels of IPV, intimate partner violence. So from the DHS survey there, you can see is around 30% of women experienced violence from a partner. It's actually an improvement on the previous decade. Looking at our own data from 2016, so the same sample of individuals, we find that around between 1 in 5 and 1 in 4 females have experienced physical violence within their household, and around 1 in 10 males. Now, as I said, there's evidence of the pandemic increasing this cycle of violence. One paper of particular interest in this context, a paper by George Aguirre, which looks at calls to domestic violence helplines in Peru, and he finds a 48% increase between April and July, so at the height of these strict lockdowns. And our results very much complement these findings, I think. So there's been a number of ways of getting at this measure of domestic violence. Clearly, not only has the pandemic made it potentially more likely that victims are going to experience these types of things, but it's also made it far harder for people to gain information on what's going on. So the main ways it's been done, there's been a number of papers using administrative data. So this would be secondhand data, such as the helpline data I just recently mentioned, but also things like hospital admissions, 911 calls, police dispatch data. And this type of data has been used extensively to look at increases in violence. There's also been a number of internet surveys which have been conducted looking at this more in high-income countries. The key issue with these two approaches is an inherent selection bias in who your sample is actually representing. So if we look at administrative data, it's very likely that those who report to a helpline or report to police are very different from those who don't. So the sample that you have may not in fact be representative of the population you're interested in. Similarly with internet surveys, particularly if you try and implement this in a low-income country, you're going to run into issues of internet access and those who have better or worse access to the internet. So more commonly in low-income countries, we've seen phone surveys. I've given a couple of papers there on the slide. All of the papers so far that we've found have used phone surveys and asked questions on domestic violence directly. So they've gone straight in and asked respondents, have you experienced violence? Now, when we saw this raised a number of clear ethical red flags to us. So obviously there's the potential for asking questions to somebody who may be a victim. There's also the possibility of talking on the phone about domestic violence with a perpetrator, maybe in the room. And all of these considerations we needed to think about when we were designing our survey. As with all sensitive topics, there's also an inherent problem of underreporting. So where we have a particularly sensitive topic and we want people to report truthfully their experiences, if there's stigma attached to that topic, as there is with domestic violence, we could expect that there will be some degree of underreporting. So the approach which we use, as I mentioned, is called list randomization. So this is an experiment which was initially devised to remove this social desirability bias from responses as much as possible. It's been used to investigate attitudes to racism, homophobia, risky sexual behavior in a variety of different contexts. The general idea is the same. So what we do is we split our sample randomly into two groups. So we have a control and a treatment group. Starting with the control group, we read them 4 statements, and these are what we refer to as non-sensitive statements. So these are statements completely unrelated to domestic violence. I've given an example there on the slide. And having read these 4 statements, we asked respondents to tell us how many of these statements apply to them. So crucially, at no point do we ask them to tell us yes or no that one particular statement applies to them. So this gives respondents a degree of anonymity to hopefully truthfully report their answers. We then go to the treatment group and we ask the same 4 non-sensitive statements, plus 1 additional targeted statement related to physical violence. And if you look at the little graphic to the left of the slide, hopefully this will give you the idea. So with successful randomization and 1 or 2 other assumptions, we could take the control group's responses to this 4 non-sensitive items as a good approximation on average of how the treatment group would respond to those 4 items. Now, of course, the treatment group are asked about 4 statements. So the residual should be a measure of the prevalence from this under certain assumptions. In our own paper, we actually use what's known as a double list design. So we switch around the control and the treatment group status of each individual and run a second experiment. And this allows us to get more precise estimates. Now, more specifically, what we do is we use a 2-stage approach to, first of all, back out this prevalence of violence and then see what is correlated with it. So what we have here in the first equation, we have Y representing the number of statements which apply to individual I answering list L. And this is in the no treatment status, so for the control group. And we regress this on a variety of individual characteristics contained in the vector X. Now, this allows us to predict the number of yes or I agree with the statement responses for our entire sample, conditional on these X characteristics. So we can get an expectation that on average, somebody with characteristics X from the vector X will respond some number between 0 and 4 to the 4 control statements. We can then take this prediction to our treatment group, deduct this from the actual observed number of statements they agree with out of 5 to create this Z hat term, which represents our measure of the predicted response to the sensitive statement, in this case, domestic violence. We then regress this on this vector of X characteristics to see what's correlated with the probability of saying that this statement on violence agreed with them. So a real snapshot of the results here. This is really pared down. So first of all, in column 1, we have the unconditional and covariates results. So the intercept actually gives the prevalence here. So this is where we get our 8.3% results, which I mentioned previously. So this tells us that around 8% of our sample would respond affirmatively to the statement, I've experienced increased domestic violence since the start of the pandemic. In column 2, we then include this vector of X control. So I've only reported female and past violence. We had all of the additional controls in there as well. So we have education, cash transfers. We actually had a scale of attitudes to women. This was an index we created, as well as the days in lockdown as well. The only coefficient that we found to be a significant predictor of giving a positive response to the sensitive statement was past violence. And this is a very large effect. So to interpret this, this tells us that there's an 18% increase in the probability of experiencing increased violence during the lockdown if you've experienced past violence in 2016. And that's relative to the group who haven't experienced past violence. So a more graphical representation here, we have different subgroups. So this is the estimated proportion of each subgroup which experienced violence based on our model. So a subgroup for females and males, those who experience past violence, those who experience no past violence. So around 6% of females, around 10% of males rather, experience this increase. We find it's not significantly different between these two groups. We find for past violence and no past violence, there's this huge proportion of the past violence group who experienced an increase, and this is significantly different from the other group. So just to wrap up now, so I should mention this is the first study of domestic violence which uses this list randomization approach during a phone survey. And we would argue that this is, if implemented correctly, this is a very pragmatic and very viable and ethical way of collecting this type of data, not just on violence, but on a variety of sensitive topics over the phone during the pandemic. From a policy perspective, what we find is perhaps not what we were expecting. So it's not a case that in imposing these restrictions upon households and families, everybody over a long enough period of time is suddenly become a perpetrator or a victim of violence. Instead, we find a much more subtle story. So it appears to be the case here that there needs to be an initial seed of violence within the household in order to see this escalation where governments impose these types of restrictions. So clearly from a policy perspective, this tells us who should be closely monitored as Peru continues through its second period of nationwide lockdowns on into the future. So the paper is available at Social Science and Medicine. I've left the DOI there, and I'm happy to share the slides with anybody who's interested. Thank you very much.
Thank you, Doug. That's great. Fascinating research there. We're going to open it up for questions now on those first three talks before we go to the last two papers. As I said, you can either put your hand up if you have a question, or you can put it in the chat box. So just waiting for those now. Not okay. Don't see any questions. Oh, we have Giovanni has a question. You want to just ask it, Giovanni?
Sure. Thank you very much. I have questions, but I start with the question for Doug. It was more out of interest. First of all, how did you administer the 4+1 questions? Was it done by phone or how? And the other question is like, I'm assuming from the model, but you went very quickly through that you are controlling for a number of things that probably I didn't tell because there was no time. But do you also do propensity score matching to make, you know, maybe as a robustness test? Because, you know, it could perfectly be then that, you know, the two groups are different from each other, and just controlling for a mean wouldn't do the job. So yeah, that's my questions. Thank you.
Okay, thank you very much for the question. So on your first point, so yes, we did administer these over the phone. So there were issues with this, and we had to get quite creative in the way we dealt with this. So, for example, we were worried a little bit about the recall as we were listing these 4 questions off. Could they recall which ones they agreed with? So what we did is we simply asked them to close their fist. So we're talking over the phone, so to close your fist. Every time you hear a question that you agree with, extend one finger. At the end, we'll ask how many fingers you have extended, and that's your answer to the number of questions. So this addressed a few of the concerns about implementing it over the phone. In terms of the propensity score matching, so we didn't actually implement propensity score matching. It would have been quite an interesting thing to look at, actually. What we did do, I know it's not the same, but what we did do is we did check for balance between the control and the treatment group in as many variables as we could. So there was good balance there was good randomization between our 2 groups. So to that extent, you know, we've gone a long way to saying that, you know, the response of the control group would be a good approximation of the responses for the treatment group. But I certainly like the idea of propensity score matching, and that's something we could look into in the future.
Thank you very much.
Other questions? Caitlyn, did you still have one?
Yeah, thank you. Also a question for Doug. I'm really curious if you could talk to us a little bit more about the ethical considerations of this kind of work. I mean, right at the start of the pandemic, there was a global gender and COVID-19 working group formed who made it quite clear, the sort of consensus, that we could make an assumption that there would be an increase in domestic violence globally at this time, and that the priority should really be on trying to understand access to services, precisely because of all of the ethical considerations involved in doing this kind of research remotely. So I just wondered if you could talk to us a little bit more about your thinking through the ethical considerations of the work, and maybe reflect on a little bit on the ethics of what kinds of data we prioritize collecting during a crisis, during a pandemic. Thank you.
Absolutely, and that's a great question. I mean, in everything we were doing, the ethics were really at the forefront of it. So I absolutely agree that there's a possibility of making situations worse in doing this, and I believe the ethics in some of the other studies to be slightly dubious in the way that they've done it. We went as far as we could think of as possible to avoid that kind of issue. So what I didn't mention there is we also gave out consultation documents on domestic violence to everybody that we consulted with, whether they, regardless of what responses they gave during the experiment. We also were in close contact with the enumerators, and they weren't reporting back to us any particular signs of distress from everybody in doing it. Had we done that, we might have reassessed what we were doing. I do agree with the assumption that it is going to increase. I certainly agree with that, and I believe that was predictable. What I think we add to it is we give information on where limited resources can be targeted. So we need to know, we really need to know where the vulnerable groups are going to lie. So it may be the case that there's certain groups where we could provide better access for within countries to these resources that you're talking about. And there was a lot of discussions about whether or not we should even do this. In fact, we didn't do this in some of the other countries because there wasn't a good enough infrastructure to provide support to potential victims. In Peru, there was, which is why we went ahead with Peru. But I suppose in the end, we decided that the importance of understanding who was vulnerable weighed up against the ethical considerations. If we went as far as we could to avoid those, warranted going ahead and doing this in as sensitive way as possible, which is what we tried to do. But a very good question, thank you.
I can't see any other questions, but just one for Corey, perhaps, before we go on. Corey, I know your work's at a very early stage, so it's just one about the process of kind of setting up the research. But I wonder if you could speak a little bit about how you chose the cases that you did to study here. You didn't quite explain which, why you chose those different cases. Was it just geographic, or was it access, or what kind of considerations played a role?
Yeah, thanks, Matt. The simple answer to that is that it was based on the long-standing research relationships with communities in those areas by our researchers. So everyone who is in our research team is a member of the Nomadic Peoples Commission, which is basically an anthropological group that deals with nomadic studies issues and was formed in the 1970s. So we got together this group and we tried to get as much diversity in this initial sample as we could. I'll note that we're also missing a lot. We have a very heavy focus on pastoralism, and we haven't, for example, included any itinerant forest communities. We're also, I think the biggest glaring issue, which you probably saw on the map, is we're missing the entire Western Hemisphere. But for the purposes of an early exploratory study to try to get a sense of whether this question of a sedentist bias in the health response is relevant, this is sort of a useful exploratory study. We are one of the things we're doing is we're putting together a final workshop, which hopefully will be to some degree in person for October, depending on what the situation is. And the idea would be to bring together a more diverse array of people working on mobile people's issues and to get some more geographical breadth as well.
Great, thanks very much. I think we should crack on with the rest of the talks now, given the time. I noticed Giovanni has a question, but perhaps you could ask that when we have questions at the end, when it's possible to come back to any speaker. But are we right in thinking that Joris is ready to go now?
Yes, I've got your PowerPoint. Yeah.
Absolutely brilliant. So I introduced you, Joris, already. So do you want to just take it away?
Yes, perfect. So yeah, thanks a lot again for the introduction and also for the opportunity to speak, and sorry again for the technical issues. So yeah, as Matthew said, so I'm working as a research officer with the International Organization for Migration, focusing on the Middle East and North Africa. And the research I want to present is on the socioeconomic impact of COVID-19 on migrants and displaced persons in the Middle East and North Africa. Can you all see the slides? Okay, it just started. Perfect. So yeah, so next slide, please. So yeah, so before I start with presenting the results, I want to go back very quickly to the genesis of the research. So this line of work on the socioeconomic impact of COVID-19 came from two basic observations. So the first one is that COVID-19 is obviously not just a health crisis; it also has a tremendous impact on the livelihoods of entire populations. And as such, we thought it was interesting to analyze it through a socioeconomic lens and not just a health lens. Besides this, the second observation was that there was very little research engagement in the Middle East and North Africa to understand the specific ways through which mobile populations could be impacted by the pandemic. Despite the fact that this is an essential information, this is essential to make relevant policy and programming and to make it relevant to the needs of migrants and IDPs in the region. And so this is why we decided to focus our research efforts on this. Next slide, please. And so to fill out this research gap, we decided to look at 6 key areas that we call pillars. So there is the first one, which obviously is on health. Then we have another one on access to basic services, including access to humanitarian assistance and social protection. Then we have number 3 and number 4, which look at different economic indicators. So employment, ability for business owners to sustain their enterprises, ability to receive and send remittances. And we have pillar number 5 also on social cohesion and relations between hosts and mobile populations. And finally, the one in red is on mobility, and it looks at the impact of COVID-19 on different mobility patterns. So after establishing this sort of broad framework and defining a set of indicators for each of the pillars, we went on to collecting data mostly through interviews and surveys with many different stakeholders that included humanitarian practitioners, members of governments, and also obviously migrants and displaced people themselves. And we managed to collect some data in 8 countries of the region. So 4 that we call humanitarian countries, which are Yemen, Libya, Sudan, and Iraq, and 4 that we call non-humanitarian, which are Algeria, Egypt, Jordan, and Tunisia. Next slide, please. So obviously, I don't have time to talk about all of the findings from this research, but I want to give 3 examples of very concrete findings that we were able to obtain through conducting this study. So the first one is under the pillar on health. So we looked at the level of awareness that mobile populations in the region have about the virus. And so it appeared clearly that the knowledge around the virus's effects and also knowledge around infection prevention measures was not uniform across neither geographical locations or populations. So in Iraq and Jordan, for instance, what came out clearly is that migrants who did not speak the national language, so Arabic in that case, were much less likely to be aware of social distancing measures or to know where they could get treatment if they were infected by COVID, or to know what to do if they were infected by COVID more generally. And on the other hand, we had the cases of Algeria, Tunisia, and Libya, where we noticed that migrants who had already experienced an epidemic, such as Ebola in the past, were much more likely to know what to do in order to avoid spreading the virus. Many of them knew about social distancing measures, and they were more likely to put them in place. And we also found interesting that they oftentimes organically shared their knowledge with migrants from different nationalities who were part of the same communities. So yeah, from the perspective of humanitarian agencies, like from a policy perspective, it's really useful to collect this type of information, because it has the potential to help target limited resources towards better communication, and to target especially who to whom communication around the disease should be addressed to. Next slide, please. So yeah, the second finding I want to touch upon is under our pillar 3, so on employment and income generating activities. I mean, this finding is not surprising, but I think it's worth noting still. So what came out is that migrants and IDPs in the region, so overall, we're heavily impacted by job loss, much more so than non-mobile populations. However, we noticed, like, what's also worth noting is that some profiles of mobile populations were particularly impacted by employment loss. And especially migrants who are in irregular situations reported that oftentimes reported that they were dismissed, or that they had their salary reduced, or that they had to work longer hours for the same salary. And that came as a result of increased competition for jobs. And sometimes that had dramatic consequences, such as inability to meet basic food or medical needs, also potentially being evicted from one's apartment, and also in some cases that we came across, being forced to resort to sex work as a coping strategy. So yeah, again, this type of information from a policy perspective is essential to help target the type of interventions that can be that are useful for that are relevant to the needs of different populations. Next slide, please. So yeah, the last example I want to touch upon is under our mobility pillar. So what we're trying to assess with this pillar is how and to what extent mobility in the region was modified by the pandemic. To do so, we looked at state policies related to COVID-19 and especially to mobility restrictions. And so we built a proxy to determine how freedom of movement was impacted both at national and international levels. So I included here a graph related to freedom of movement at international level. And so that was made by analyzing what we call the status of ports of entry. So basically, whether key ports of entry, so for instance, airports, ports, roads at borders were open or closed, and for how long. And based on this, we determined which countries put in place the most drastic mobility restriction measures. And so, for instance, what we see from this graph is that Algeria and Jordan have put, like, compared to other countries, have put the strictest restrictions on international travel. That being said, despite the fact that mobility, sometimes heavy mobility restrictions were put in place by state to curb the spread of the disease, we're not able to conclude that COVID-19, that the COVID pandemic curbs mobility in the region. Rather, what we noticed was if not the opposite, at least we noticed that different other mobility patterns were created. So we noticed, for instance, increased number of returns of migrants to their country of origins due to lack of financial assets, or because the situation in migration was too difficult. Also, we noticed that the number of people who crossed the Mediterranean did not drop. We also have some survey results from Yemen, where some IDPs reported that they had to move from their first place of displacement, from their first displacement location, for fear of contracting the virus, or because they could not access health facilities in that specific place because they were overcrowded because of the pandemic. So yeah, overall, we can't conclude that. I mean, what we can conclude is that surely COVID-19 changed mobility patterns, but yeah, it's impossible to say that it led to an overall decrease in mobility. Next slide, please. yeah, that's it in terms of results. So if any of you are interested in learning more about our results, so we published a report and I put the link here. And we'll also do some presentations in coming weeks and months. So if anyone's interested, I can send the invitations. So yeah, thank you very much. Thanks a lot for your attention.
Thank you, Joris. That was worth the wait. Now let's go to our last paper, which is, or talk, which is a double person talk. We have both Louisa, Enria, and Caitlyn Proctor, who are alumni of ODID in their own different, both alumni from the DPhil in International Development, with Louisa finishing in 2015 and Caitlyn just recently in 2019. Caitlyn is now a part-time professor at the university, at the EUI in Florence, after having finished a Max Weber fellowship there. And Louisa is assistant professor at the London School of Hygiene and Tropical Medicine. And the title of their talk is The Role of Social Science in Humanitarian Health Responses. So I'll pass it on to you two.
Great, thank you so much for the introductions and thanks for the invitation to be here today. Louisa, should I kick off and then hand over? Does that, yeah? We thought to sort of structure this more as a kind of conversation, really. I mean, both, well, Louisa much more so than myself, but we've both been involved in ongoing COVID-19 related work together in Palestine, and Louisa also in Sierra Leone, and with a lot of remarkable similarities actually coming out of the kinds of studies that we've been doing. So we thought I could first very briefly share with you the study that we did in Palestine, and then Louisa will share more from her work, and then there'll be time for some sort of reflective points, particularly around what kinds of roles we see. I mean, we both have done a lot of practitioner work within the humanitarian and development sector as well, and we're both very keen to try and do academic research that's meaningful and useful, but are coming up against various barriers to doing that. So definitely some reflections on the role of social science in humanitarian work moving forward. So to start with, we were together involved last year in a study focusing on the Gaza Strip. It was conducted with rapid research funding from Enria, which came out sort of at the start of COVID last year, which was specifically to do academic work on COVID in humanitarian settings. And they were really trying to partner academics with institutions and humanitarian organizations to try and bring a rigorous evidence base into the COVID response in humanitarian settings. So initially we formed a partnership. So sorry, I should say this. So we applied for and got this funding with the support of another former QEH scholar, Dr. Jason Hart, who's now at the University of Bath. He was the PI on this study, and we built a team between us, primarily of anthropologists, but the people who had either done extensive work in Palestine or Palestinian refugee communities before, or with academics who'd been working on public health responses in humanitarian settings. So we planned to do this work with UNRWA, the Palestinian Refugee Agency, and the idea initially was to look right at the start of COVID on rumors and misinformation in communities in the Gaza Strip. Now, as I'm sure many of you know, Gaza is one of the most densely populated places in the world. It's home to 2 million Palestinians in just 365 square kilometers of land. Gaza has also been under blockade since 2007, which has really limited the capacity of the Hamas government in Gaza to respond to COVID, and has led to a deep reliance over many years on the humanitarian sector. So we got this funding last April. We weren't actually able to start the research until late summer of last year due to complications with UNRWA, who eventually weren't able to support an ongoing research process because they were too caught up in the delivery of frontline assistance. So then we shifted to work with 15 community organizations across Gaza instead. It was a qualitative study. We used 3 primary methods. We did semi-structured interviews by phone and Skype and WhatsApp. We did a diary exercise with young people, which was an attempt to try and bring youth perspectives into the study. And then we used WhatsApp voice notes as a way of asking a smaller number of questions to a wider number of people. So we worked with just over 100 research participants overall. And really, we were looking to understand the level of understanding and rumors and misinformation around COVID, but also to reflect on how public health measures were being implemented. So just to share very quickly some of the key findings of that study, we found that social media was really prioritized as a source of information over official media outlets, and that rumors around COVID were pervasive, but they really changed over time, and they really changed over the period of the study. So to start off with, there were rumors circulating about how to avoid the virus, for instance, but over time, they turned much more towards rumors around sort of the source of the virus and theories about how the virus got into Gaza in the first place. And this was all then related back to the Israeli state and sort of ongoing settler colonial politics. Another key finding was around avoidance of healthcare centers because of COVID-19. So we found not only were people who had symptoms of COVID not going for tests or going for treatment, but people with long-term health conditions were also not seeking out care. But it wasn't really in connection to COVID itself. It was rather in connection to a fear of what being put into a quarantine situation because of having COVID symptoms would be. So a huge part of the research then turned to focus on how people's livelihoods were being impacted by quarantine measures and the complete inability to comply with lockdown because of the kinds of livelihoods that people maintain in Gaza. And then this led to another key finding, which was also about the increased surveillance that was happening at the hands of Hamas as a result of COVID. And with a lot of people reporting that they understood that lockdown measures were actually being used, and particularly when people were being sent to quarantine facilities, they were also having their phones taken away from them, their laptops taken away from them, being asked for passwords for things, for instance. So there was a wide perception that COVID was sort of being used by the regime as a cover-up for sort of ongoing surveillance across the Gaza Strip. Despite wide humanitarian campaigns that were taking place in Gaza around gender-based violence, domestic violence, child protection issues during COVID, we found no evidence of knowledge of those systems among the people that we worked with. So, for example, very limited awareness, or no awareness, in fact, of access to hotlines or safe houses, that kind of thing. But again, this was then sort of linked by our participants more to an overall lack of trust in the international community and lack of trust that their needs could be provided for in such a time. I'll maybe leave it there and hand over to you now, Louisa, and then we could talk together about dissemination or challenges therein.
Yeah, sounds great. Thanks, Caitlyn. Yeah, so as Caitlyn said, I'll talk a little bit about what we've been doing in Sierra Leone. And I think, as Caitlyn mentioned, we've both been really struck by sort of the real similarities in experiences, but also kind of through the comparison have been able to also see how specific to particular histories and political and social contexts some of these, the actual kind of manifestations of these findings are across these 2 different places. But I just very briefly wanted to sort of contextualize the work that we've been doing on COVID in Sierra Leone by kind of rewinding a few years and kind of thinking about the work that we were doing during the Ebola epidemic between 2014 and 2016. Especially because this relates to the questions we want to kind of bring up at the end about, what is the place of social science in these spaces and in humanitarian crises infrastructures in general. So during Ebola, as some of you may know or not, there was sort of an unprecedented mobilization of anthropologists and social scientists to take active part in their response and to sort of influence and critique the ways in which the response was taking place, especially particularly sort of securitized approaches to the response to Ebola and approaches that weren't taking into account local culture, social context, and just the lived experience and knowledge of people who were affected by Ebola and by the public health measures that were put in place. So I was involved, I was deployed as a social scientist in the Ebola vaccine trials at the time, and I'm actually still involved in that. And I think there, and we'll talk about it a little bit more in a second, but I think there was this kind of space created, or this moment created, where it was possible and seen as very valuable to have these kinds of social science insights and inputs into the design of epidemic response measures. But I think for me, at least, COVID has really shown how that space was very specific to that moment. And also potentially very specific to doing epidemic response elsewhere, if that makes sense. So that knowledge kind of only going in one direction a lot of the time. But at the time, I think the major lesson that we took from Ebola certainly is really closely related to what Caitlyn has been talking about the importance of of understanding the essence of trust and the importance of trust in the response. So not just in terms of kind of contextualizing and historicizing mistrust in different kinds of epidemic response measures and different actors who are involved in an epidemic response, but also flipping the lens. So rather than just looking at resistance, for example, or reluctance to take vaccines or to be quarantined and so on, to think about how humanitarian actors can make themselves more trustworthy, or how they can kind of confront some of the historical and political dynamics that make them untrustworthy in some contexts, or at least perceived to be untrustworthy. So after Ebola, we were with my team at London School, we were involved in sort of a range of different international networks and discussions about social science and epidemic preparedness. And we had a few projects that then, when COVID-19 happened, sort of pivoted and shifted to look at COVID-19, some with more and some with less success, I would say. And just to give you sort of a bit of an insight into the kind of stuff we were doing, just on a few months before COVID-19 started, we had piloted a community-led ethnography approach, so training community health workers to do research on vaccine confidence in the borderlands between Sierra Leone and Guinea, which was supported by the District Public Health Office in Cambia District on the border, who was very supportive, at least at the district level, of these kinds of approaches of using ethnographic insights to influence community engagement strategies for vaccine uptake. And so that meant that when COVID started, they wanted us to kind of shift and expand the project to include looking at the experiences of COVID on the border. And so we were providing weekly briefings to the Cambia District COVID response, and they had set up a specific social science pillar at the district level. And the findings actually were really similar to actually what others have said, and also what Caitlyn has mentioned. So we were kind of tracing rumors and anxieties over time and kind of seeing how they shifted, especially as COVID kind of came closer to home. But also we were able to kind of situate it in these longer histories and political economies. For example, there were narratives about kind of extractive Western interests being behind the spread of COVID-19, or perceptions that some were profiting from eating Corona money, kind of based on previous experiences with Ebola, for example. And then similarly, there were often sort of mismatches between what were often one-size-fit-all public health responses like lockdowns, which just were inappropriate for the Sierra Leonean context, where people were just unable to provide them food for themselves and their families, for example, during lockdowns. But also the secondary impacts, so the fact that people were avoiding health centers for fear of being infected with COVID, having kind of pretty significant effects on a kind of health seeking for other illnesses and other issues that actually in the Sierra Leonean context were probably more significant than the actual impact of COVID itself. A few of the sort of other ongoing projects that we've shifted to focus on COVID, we've been doing some kind of deliberative discussions in rural areas around vaccine deployment and justice. So kind of thinking about what people think about different strategies for vaccine deployment. And we've been looking at the relationship between rumors online and offline, and kind of thinking about the relationship between the two. So that's really just a really rapid overview of the work that we've been doing. And we've got some reflections, I guess, hopefully there's time on kind of why it's been difficult, I guess, to sort of make sure that social science perspectives are integrated into the humanitarian crisis management. Should I give a couple of thoughts, Caitlyn, then pass it back to you?
Are we okay for time, Matthew, if we go on?
A little bit. We're kind of pushing the boundaries now, but yeah. I mean, maybe if you could be quick on that.
You go, Louisa.
Yeah, just a very brief point. I think, as I said, so I think during Ebola and since then, at least in the kind of West African context, there were a lot of openings, but it's remained very difficult because interdisciplinary work is difficult. There's often kind of a hierarchies of knowledge and evidence and different kind of values around quantitative versus qualitative research. And I think those spaces are quite difficult to navigate, and it kind of meaningful co-production sort of goes out of the window, I think, during crisis to some extent. And I think that's been really the biggest challenge. And then just very briefly to say that what I was sort of referring to is that whilst I think in Sierra Leone, there was a huge amount of learning from the West African experience, it was actually much harder to kind of think about how that experience, which was heavily funded by the UK, for example, wasn't seen to be relevant for learning lessons in Europe or in the UK, when I would argue that it was.
Let's leave it there, and if there are more questions, we can come back. Thank
you, Caitlyn, and thanks for that. Well, it was two kinds of talks in a way, so you deserved a bit longer. So let's open it up for questions now. Have we got any questions? Everyone's silent because they've gone for lunch here. Okay. Giovanni.
Sure. I didn't want to step in and leave questions to others too, but I had a question before for Corey, but I'm not sure Corey's there.
I am. Yep.
All right. Okay. Corey, just from which is a very fascinating research project you guys have there. And I was going to ask first, maybe just sharing here a comment of the difficulties we were having here with interviewing. I'm assuming that all your interviews are going to be online, right? Yeah.
Actually, the key informant interviews will be online, or they'll be, remote in some way. We have actually put forward to CUREC, we've gotten permission to do a few socially distanced in-person interviews with certain members of the community. For example, in the place where I work in Turkana, a lot of the pastoralists we would be contacting are online for remote interviews.
Right. So my point was just that it's very hard to reach out to the most fragile people. For us, it was workers in factories that you couldn't really interview online. So you have to rely on NGOs or on managers. For us was the case, or on other people. So it's very hard to run triangulation. And these people have an agenda, right? So NGOs would have an interest in sharing certain narrative, and government authorities another narrative. So it becomes very hard to triangulate this information with effectively the people you're trying to talk about. So that's a major issue we are having right now. We're running, for instance, research with workers in the apparel industry. So just to worry you or to think that properly, because it's likely that it may be hard to get to those. And the other point I had was about you said you're not going to collect data, you're trying to identify existing data set. And I don't know in other countries, but I think that in Italy, for instance, for the Sentirai, there are these kind of laws that prevent you from saying who's getting the vaccine in the ethnicity of these people. So it may become very hard to access to COVID or access to COVID vaccines or to cures based on ethnicity. This data may not exist. Definitely they won't exist in Italy. I'm not sure about other places where maybe ethnic groups are less sensitive thing. Yeah.
Mm-hmm. Yeah, I mean, I would just say that's definitely that last issue that you brought up is definitely an issue. It's different in every site how we're actually going to identify the groups, the target groups that are of interest. In some locations, it's quite easy because it's geographical. So if you're not, most of the people, for example, in Turkana who are not living in urban centers are pastoralists. So geographically, it makes it quite easy to identify those who are participating in mobile livelihoods. That is more complicated with Romani communities. And I'm not going to speak to the methods that they're taking yet, because that's actually not one of the sites that I'm working on specifically. But one of the things they are looking at is some of the NGOs. So the government may not be keeping sort of data that indicates, which community you're from whenever you're, say, getting a test, or if there's provision of vaccines, but they would. There's some NGOs that are providing services specifically to traveler or Romani communities might actually have particular data. So that these are some of the sorts of information we're looking at. And I'd also just, I guess this is sort of bringing up a broader question that's maybe for others, and I'd be keen to hear what especially what Louisa and Caitlyn are thinking is this, if you were relying at all on, in terms of interviews, the use, something that's happened during COVID is the increased use of field assistance. So that is one of the approaches that we're taking. No one on our team is traveling for any of the research that we're doing, but they're relying on local field assistants with whom they have a relationship, with whom they've presumably worked in the past. And I guess that would just be one of the questions is if you've had any issues in dealing with that. In our case, it's thus far worked pretty well. It avoids some of the risks around travel. It generally means that it's someone who's already in the community who's doing the research. Just wondering what some of the maybe ethical issues you've dealt with in that regard are, if any.
Do you want to jump in there, Caitlyn and Louisa?
Yeah, I mean, in our work, we actually did, because at the time that we were doing our COVID research, there was supposed to be a full lockdown everywhere. It wasn't being observed, but it was deemed too unethical to ask other people to also go and do in-person work. So that's why we did all of the work ourselves, but via phone, and organizing sort of credit transfers to people, to their mobile phone numbers, so that they could take the calls and use data. But maybe Louisa, you've had more experience of working with researchers in the field.
Yeah, I mean, similarly, we had I guess we were lucky. We had a team of people already based there that we've been working with, and for the last 5 years or so. So they were doing the research. I think it's a good thing, and it's kind of a good opportunity as well, as long as they're kind of fully involved in the whole process, I think, and kind of recognized as well. And I think I feel the question for me throughout was kind of the displacement of risk, I guess, and kind of feeling like you're outsourcing the risk to someone else. So we kind of did a lot of thinking about how to minimize risk, and also questioning whether we really needed to be collecting. We stopped data collection for quite a while when it felt unsafe, or things that, that involved going into people's homes and things like that, even at the point where the Sierra Leone government wasn't restricting that. We just kind of made decisions ourselves.
I'm conscious of the time. I have one question for Joris, but I would have a bunch for Louisa and Caitlyn, because I think that was a very fascinating paper as well. And I just think this question of how the issue of COVID becomes refracted through relations of trust with particular kinds of institutions and organizations is just a really kind of fascinating one, and just shows how forms of injustice, I suppose, and kind of inequality can themselves stand in the way of dealing with global issues like a pandemic, which is another kind of argument, I suppose you could say, for a kind of interest in dealing with some of those inequalities and injustices too. But in terms of Joris's question and Joris's discussion, I just wanted to ask you, Joris, whether there was any evidence in terms of changing mobility patterns, of whether COVID changed the mobility patterns of various groups of migrants out of their own desire to avoid COVID. You pretty much concentrated on the issue of state controls, but not the level of individual decision making. And it might have been difficult to kind of drill into that, but I think that's probably an important question here too. And then if not, why not? Does that relate to some of the issues Caitlyn was talking about the kind of necessity not to be contained within a particular place for the need to survive?
Yes, so this is something that came up with. So we did qualitative interviews with some migrants who either had changed their mobility plans as a result of COVID, or So yes, this is something that that really came up. So despite the mobility restrictions and the state policies impeding, like trying to impede mobility, we really noticed that some migrants either had to go back home because they didn't have any financial resources, like in their place of in their place of migration, or they still decided to continue their journey towards Europe, for instance. Or also to decided to go somewhere else to access a specific service that they could not access as a result of COVID-19.
Right, thank you. I think we're going to leave it there because we are a little bit, a fair bit over time, though it was worth going over time, I have to say. Just as a kind of external observer of this work, I just found this session really, really fascinating and raised so many issues that we just don't have the time to get into here. But it's often said that one of the great joys of teaching at ODID is teaching the fantastic students we have. And I just think it's great also to see the great research that follows after that experience of transitioning from students to researchers too. So thank you. Thanks very much. I hope many of you will stay on for the afternoon session as well. But for now, have a break, have lunch, or wherever you are, have breakfast, who knows, or dinner, and have a good summer.
Thanks.
Thank you.
Thank you.